we will get started. Um, so we have I think a very unique and very special session. This is our last session of the day before we ground ourselves again and wrap up. Um, and the reason I say it's so special is multi-fold, but most importantly, it's because we're going to hear from our students. Really, these are the conversations that shape not just their future, but our future of medicine, our future as human beings in our communities, our families, our friends, and really our world. So their voice really cannot the importance of their voice cannot be emphasized enough. So today we have Samantha Bostic and Hannah Brown and Anastasia Bowie, Allison Carrol, Francesca Kabemba, Amanda Lopez, Kevin Quirk, Kyle Reed, Andrew Sullivan, and Julius Wu, who were so generous to join us despite their, as we know, very demanding schedules. Um, so really, we're just going to have a conversation for next half hour or so and really get their perspective on professionalism and on the learning environment so we can learn. And I'm going to do minimal talking. Um, and Dr. Myers, I invite you to help me moderate since this really is your expertise. Um, but we're going to just start with like some opening reflections. And my first question for our students is at your stage of training, how do you define professionalism? And secondly, how has this understanding evolved during your journey thus far? So I may call on one or two or three of you, and if you would just introduce yourself and tell us what level you're at this stage. So again, I'm asking about your definition of professionalism, and how this may have evolved. Um, may I ask if somebody wants to step in and volunteer?
I can take a stab at this first. Hi, I'm Anastasia Boy. I'm a fourth year medical student, and I am going to be applying psychiatry this year. My understanding of professionalism has evolved a lot during my Medical school, I would say. Early on, I equated with being polished, writing perfect emails, speaking certain ways, always appearing very composed. But over time, I've come to see professionalism more as personal accountability, grounded in respect, especially respect for people's time, energy, and capacity. And one small example is how my emails have gotten shorter the longer I've been in training. Not because I care less, but because I'm more cognizant of the fact that most people are reading them between patients or in the middle of a busy clinic. So to me, professionalism includes communicating with empathy for those realities by being clear, considerate, and efficient. I also think of professionalism as modeling. Before medicine, I worked with children, so maybe that still influences how I approach this concept. But I try to act as though I'm being observed by someone younger who's learning how to navigate the world, someone who I would want to show curiosity, kindness, and integrity to. But it's also about maintaining a high internal standard, even when no one's watching, holding yourself accountable to the same values you hope to model for others. So it's not about perfection, but about showing up thoughtfully, owning your mistake, and creating space for others to do their best work too. So at this stage, professionalism feels less about maintaining an image for me and more about maintaining intention.
Wonderful. Thank you. Perhaps one other student might want to comment. It's a big question. Um, okay, that's okay. Let's go on to our next one. That was really that was incredibly comprehensive and insightful. Um, so now we talked a little bit over the day about conflict and ethics and challenges in our ethics. Um, I'm wondering if, maybe one or two or more of you might share a time when you faced or observed a ethical or interpersonal conflict, and how did you or those participants seem to navigate the situation? Um, and how might what did you learn from it? How do you think that's going to shape you? Um, Would one of you kindly, oh, I see Andrew
Yeah, I can
unmuted
take this.
yourself. Thank you,
Hi,
Andrew.
guys. No problem. My name's Andrew Sullivan. I'm a third year med student, thinking of applying emergency medicine next year, hopefully. Um, so when I thought about this question, what came to mind for me was like more of a general conflict between the faculty and the students that happens a lot of times with the MS1s and the MS2s, where they feel um, I hear a lot of like complaining on behalf of the students that the curriculum doesn't provide this for me, or that something's wrong with the way that we do POPs or the way that we do PBL. And I'm an older student, so I came back to med school after working in finance for 7 years. So I have a little bit of a different perspective than other students. But I feel like when I think about that, it always frustrated me to hear students complaining, and not offering a lot of solutions. And also, they were blaming kind of the faculty a lot for like not doing enough or not caring enough. And I really spent time like reflecting on what could be driving that and what is the underlying force that's causing students to feel that way and what can be done to try to address it. And what I came to realize is that I think um, that the underlying belief is that students feel for one reason or another that faculty doesn't understand them or that doesn't have their back. And so if there are some ways that faculty can build trust and help students understand that they are on the same team, um, I think that that would go a really long way. And I think it's about like helping students take accountability for their education and for their experience while they're at Downstate. Because, a lot of students are coming in as 22, 23-year-olds, they're still young. And there's this process that we undergo as we age that's like learning how to be responsible for your own experience. Um, and one thing that I've learned that I think is like a takeaway from all this is that people tend to like live up or live down to the expectations put on them.
Mhm.
And so when students are infantilized in any way, whether it's like you have to prove to us that you're doing your homework, prove to us that you're signing in, or whatever it is, in part, some students will end up living down to that expectation instead of living up to the expectation of being adults. And I don't know, this isn't like fully worked out in my mind how it could be implemented, but ways that you can just sort of see students as complete adults as they're coming in and expect them to act as such, like really goes a long way in engendering students doing so. Um, Trusting students to manage their own time, instilling this sort of taking ownership of your own experience in students, and that if you don't like something, either change your perspective about the situation or offer a solution to help change it. And I think you guys, faculty has done a good job of like creating sort of the different panels of students that meet and try to like offer change and solutions. So definitely, I know it's on your radar, but I think that it would go a long way to continue to sort of just like expect students to act like adults from an early point and engender this like solution-minded thinking rather than this like complaining. So that's one thing I thought of when I thought about conflict that I've seen.
Andrew, thank you. I really like what you've had to say because I think you're speaking to both your fellow students as well as to, us who are the faculty. I'd like to invite any of the other students to kind of build on what Andrew has said. If you have any suggestions where you feel students could gain their voices, that we would be able to help create that.
I can share the story from my clinical experiences, which was from my first code. Part like I will never forget that day. Part of it was because the patient who coded was the one I've been following. So when my resident called the code, the room filled pretty quickly, filled up with people. It got really hectic. I was sent to grab my team. I ran to my senior resident and attending in the hallway, so I tried to give them a quick, clear update, but there was a brief moment of confusion because my senior thought I was talking about a different patient with a very similar scenario. And in the chaos, my resident snapped at me. We quickly corrected the situation and the patient stabilized and transferred to ICU. After the code, I remember feeling conflicted. I understood that everyone was under stress, the stakes were high, but I also felt a little bit shaken. Not because of being snapped at, but because of how small I suddenly felt in the process. As a medical student, it's already kind of hard to kind of find your place in the part of the team. Sometimes you feel very out of place, like you're in everyone's way. But later that day, after our afternoon lecture, my attending stopped me in the hallway. He said he noticed that moment and just wanted to check if I was okay. And that small gesture, a moment of recognition and care, stayed with me far longer than the chaos of the code itself. In retrospect, I realized there was both like an ethical and an interpersonal tension there, the tension between efficiency and empathy, and between urgency and humanity. It's easy in medicine to believe that professionalism means suppressing emotion to stay composed, but I think true professionalism also means being aware of how our words and actions land on others, even in crisis. So I guess that experience kind of stay with me as a reminder of the kind of modeling that I want to see and the kind of physician that I want to be. Someone who can move kind of quickly when you need to, but not at the expense of kindness. Like someone who makes space for reflection and emotional safety, even when things are really, really hectic.
So, Anastasia, a quick question for you. If the attending hadn't reached out to you, you went home, you slept on this, is there any possibility that the next day you might actually approach the attending and say, can we talk about what happened yesterday?
I am not quite sure if I would have felt comfortable enough to bring it up to my attending. I was very lucky that both my attending and my resident came to me first. If that conversation had happened, I think I would have probably reflected on it a little bit more, and probably there would have been a bit more self-blaming happening. Maybe I should have been clearer about the way I communicated, things that I could have done better. But that was why it was very, very touching to me that my attending cared enough.
Sure.
He even remembered that I was there with all the chaos and everything. But he remembered that I was there, and he remembered that there was a moment when I could have felt uncomfortable. So that was very, very memorable to me.
Thank you.
And I saw that Allison, I'm not sure if you were going to unmute yourself to respond, and if you were, I'd welcome you to do so.
Yeah, I hope it's not too loud. Sorry, I'm at the cafeteria because I'm on rotations.
Fine.
But I kind of just building on top of what Anastasia said, is very much along the same lines of I remember more so my experience for interpersonal conflict was during PBL and understanding how to have a conversation with each other when there were different opinions of how, especially when we were doing role playing of different situations, of how different people would approach different situations. And I thought one way that kind of we navigated that was making sure like it was pausing when it got a little bit too high, especially when people hadn't had a debate or a conversation like that before. And then kind of starting the conversation, seeing both sides and then continuing on instead of just having like a one-sided conversation, the other person not being able to have their side heard. And I think that was one of the really like, good experiences I had during PBL, and it was mitigated mainly by our instructor. So I thought that was one of the really professionalism things that was taught to us.
Good.
Thank you.
Thank you.
Maybe we'll move on to our next question. And the question is, professionalism, often means different things across generations, which we're already starting to perceive based on these discussions and that we've alluded to throughout the day. What I would ask is your perspective on these differences and where you see opportunities for alliance and co-learning or reciprocal mentorship. These are terms that I really, really like very much. So again, cross-generational differences in thinking from your perspective and opportunities to co-learn.
I can try taking on this one.
Oh, thanks.
So I think in my perspective, one of the differences between generations in terms of what professionalism looks like is the notion of who exactly gets to be a doctor and what does a doctor look like. And I think we all have this notion of the stereotypical doctor and what they look like, and how that can potentially perpetuate sort of these stereotypes and divides between doctors and patients in terms of different things like racial or ethnic identity, socioeconomic status. And bringing in my own perspective into this, I'm from the transgender community. So I grew up sort of being told that people like me did not become doctors, and that, in fact, we didn't really become much of anything. Um, and that was a perspective that really stuck with me growing up, and it influenced my notion of, who am I and what do I bring to the medical space? And how is this going to affect me when I become a practicing physician in the future, and how I treat students and patients alike? So I grew up with this understanding, and as the culture towards sort of acceptance towards trans people grew, it sort of turned into, okay, I can become a doctor, but I shouldn't tell other people or other patients about my identity because it will give me less legitimacy as a medical professional. And I was grappling with this as I was on my pre-med journey, and eventually it turned into, okay, I can be out as transgender to certain people, but is it worth it for me to mention on my residency application? Our program director is going to see that and think that I have a certain perspective, or that they know who I am without really knowing who I am. So it's these kinds of questions about identity that have really followed me as I engaged in my journey throughout medical training. I do think nowadays we have a more wider acceptance of who a doctor can be and what a doctor can look like, and seeing generally different populations on a more equal footing in terms of both students and patients alike. Um, so that's the sort of perspective that I have. I think as the years have gone by, we've made strides in accepting that a good doctor can come from anywhere and can look like anyone. But I do think that there is always more that we can do towards promoting acceptance in this way. So something that I'd like us to continue learning and building upon is the thought that physicians can look like anyone, and they can come from anywhere. So those are my thoughts.
Julius, thank you. Thank you so much for that. That your sharing is really important. I also want to put a plug in for allyship, because one thing I've heard in my work as a, serving as ombudsperson, but also in my work, as a psychiatrist and stuff like that, how individuals with lived experience are really moving the needle in so many respects and really revolutionizing medicine. But yet, allyship is extremely important. So when and if individuals maybe don't necessarily identify with having lived experience, those of us, though, who work with those individuals or their colleagues, I think it's extremely important that we join them in this quest to modernize medical thinking. Just one final comment, Julius, that sometimes people here will say, this is downstate. Maybe this is a little bit different than some other places, because I know some others are concerned about certain places they're applying to where they think that, I'm not sure if this is a place where I'm going to be fully transparent or not. I would love to be, but I'm not sure. And I think that kind of ambivalence or hesitation is completely understandable.
Thank you, Dr. Myers. Before we go on to invite another student, I do want to say, in the vein of co-learning and reciprocal mentorship, that I have personally learned so much from my junior colleagues, the students, about being authentic and the importance of being your authentic person, and meshing that with being somebody's doctor. So your comments, firstly, I've worked with you and learned from you and others, but they mean, I think that's resonates with my personal growth as a senior faculty member. Just wondering if somebody else would like to respond to that question as well.
Samantha should talk.
Oh, Samantha, wonderful. Go ahead, please.
Hi, everybody. My name is Samantha. Most people call me Sam. I'm a third-year medical student, and I would like to practice family medicine. And I also wanted to address a much different aspect of professionalism across generations. And what I've been thinking about is how, when we start our clinical years, we step into these environments and we quickly realize within these environments that there's a sort of inherited hierarchy, right? It's existed for a long time and it exists for many reasons, but a lot of the times it's one that can seem to support deference more so than dialogue, right? And I think it's an environment that values respect, and it's one that's embedded in medicine. But in practice, it feels like we quickly kind of learn this like choreography that we're all supposed to know, right? And it's one that can create distance in a way that makes learning harder and relationships feel a bit less human. And I think that traditional ideas about professionalism were shaped at a time when endurance was equated with capability and commitment, and it was how people learned grit and adaptability. But I'm wondering if that's a model that still serves the medical community, you know, physicians and patients alike, because I think that sometimes that same stoicism that builds resilience can also erode compassion and curiosity and trust when it's taken too far. So that being said, of course, there's opportunities for alliance within that sort of tension, right? I think that senior physicians carry a long learned and earned wisdom about accountability and perseverance, and it's something that I deeply respect. And at the same time, I believe that my generation brings more of a growing awareness that perhaps humility and vulnerability and creating safety and learning environments in a way that supports a more bidirectional mentorship is not a deficit as much as a condition that allows more real learning to happen within those connections and that collaboration. And so, of course, this isn't, a universal truth. We all encounter a spectrum of experiences with senior physicians and colleagues and people we work with. And I'm also not naive to the more systemic and personal factors that can contribute to the way that professionalism is practiced and experienced. But something, I wish more in this community were, it's something that I wish more in this community were in tune with, because I think that when you foster an environment such as the one that I've mentioned, it's something that reminds students that medicine is a shared human practice, right? And not just a performance of authority. And I think the opportunity isn't to reject this hierarchy, right? But really to humanize it.
Thank you. That last phrase, not rejecting the hierarchy, but humanizing it, is really going to sit with me for some time. I need to chew on that. And I think really some of your response was, I know you may not have been here in the morning, but our plenary speaker actually spoke exactly to that, at the erosion of compassion, as you mentioned it, and really needing to be well to take care of others. And your generation is sort of highlighting that. We always knew it, but didn't act on it, I would say, or maybe we didn't even know it. So thank you so much for that response. It had a great impact. Maybe following up on that, and this question I hope doesn't make you feel self-conscious, because it's sort of asking for a criticism. But if you could change one thing about how professionalism is taught or assessed, and I'm opening this up to the group, what would it be? And if you can, share why.
I feel comfortable speaking of this. My
Great.
name's Kevin Quirk. I'm a second-year medical student. I think one kind of focal point of professionalism from the medical student perspective is that it's a criteria that we're being evaluated on by our superiors. And I think that's important because there's standards that physicians have to adhere to. But I think another more helpful way to maybe frame it for us is from the patient's perspective. And I think from the patient's perspective within the interaction with their physician, professionalism is just feeling understood, well cared for, and completely confident in their physician's ability to care for them and to treat their problem. And that, so I just think looking at it from the patient's perspective might be a helpful way to do so.
Yeah, thank you for that. That's really helpful for us as educators to hear that piece of advice and to be able to hit that home for folks. Thank you, Kevin. Anybody else? I know this is I hope you consider this a brave space to respond. If not, it's okay.
I can chime in a little. If I could change one thing about how professionalism is taught, it would be to center it around psychological safety and kindness rather than rigid standards of behavior. I feel like professionalism is very often framed as composure, the absence of mistakes instead of the presence of empathy. But in practice, professionalism is relational. It's how we make others feel safe enough to learn, to ask for help, and to recover when things go wrong. So I think part of that means being more flexible about how professionalism look in different contexts. What it means to show respect in a busy ER may look very different from a quiet outpatient clinic, but both can be rooted in the same intention: awareness, respect, and compassion for the people around you. I think that we rarely teach that nuance. So we teach rules instead of reflection. So I think we want to move away from punitive assessments of professionalism. When a student is told they've been unprofessional, is sometimes come without context or guidance, and that shuts down growth. The most meaningful lessons I've learned comes from mentorship, from people who model professionalism through compassion and constructive feedback, not judgment. So I would, if I could change one thing, I know that was more than a one thing, but it would be teaching professionalism is a shared practice of kindness and accountability, shaped by context and strengthened through mentorship, something we model for each other, not something that we police.
Thank you.
And can I just piggyback on that? I think that definitely speaks to like what I was talking about earlier, and that maybe the reason that students are complaining without offering solution is sort of like a fear response in that they shut down and they're not bringing sort of their creative energy to the table because they're feeling as though they're being judged or as though that, you know, there's a high expectation of them without the expectation of bringing their vulnerable self to the table. And if the environment were set up and created in such a way that their vulnerability was celebrated and failures were celebrated as well, if they happen, I mean, in terms of learning experiences, then maybe people might be more open and just naturally willing to bring solution-oriented thinking to the table without fear of judgment.
Yeah. And that word judgment cannot be, I think, emphasized enough. It is different than being evaluated. It is different than being assessed. So thank you. So I'm going to ask one more question before our final quick fire round. And that's, in your experience, what elements of the learning environment, this is a symposium from the Learning Environment Committee. So what elements of the learning environment do you see as enabling your ability to thrive, you know, either academically or in your wellness? If you do have that insight, you might share.
Comment on this.
Please.
I think kind of the thread that ties together everything I want to say about this is just like when residents and attendings and really anybody around me, you know, scrub techs, whoever it is, really are paying attention to what I'm doing and noticing those opportunities to really teach me, as opposed to just quizzing me or challenging what I'm doing. I think, you know, I think if I could change one thing about how professionalism is taught or assessed, I guess it would be like, you know, kind of engaging with that teaching relationship, which is really what medical school is all about. With residents, there are a couple like specific examples that come to mind. One, my very first rotation in surgery, I was with an intern who I remember one time like the scissors just didn't cut the suture that I was trying to cut because they were a little bit dull. And like afterward, he like found some kind of dull scissors and sat with me and showed how you could use the like torque on the scissors to make them cut the suture, even if the scissors were a little bit dull. And, you know, I thought that that was exemplary in terms of like kind of working on that like teaching professional relationship, and also like invited me into the professional space. And then also in psychiatry, there was one intern who like really was taking notes, not necessarily on like the content of what the patient was saying, because I was going to write the intake note for the patient, but was taking notes on how I was interviewing and then went through them with me after the fact. And those are things that I'll take with me forever, just because like it was, you know, so important that someone was really paying attention to what I was doing and like used that to teach me in the most effective way possible. Both downstate grads, which I don't think is a coincidence. So, yeah.
Amanda, it's sort of uncanny how similar my response was going to be to yours, because I was going to say, as a response to this question, I feel like I thrive the most when there's explicit space carved out for us as trainees and medical students in the learning environment. For me, I'm not really the most talkative person, so I sometimes struggle with speaking up if I don't really feel specifically empowered to do so. And a lot of times we've talked about already sort of how medical students' experience in the learning environment can sometimes be ruled by fear. Um, fear in a preclinical environment of getting the question wrong, fear in the clinical environment of looking like you don't know what you're talking about in front of your residents and your attendings. And sometimes that can create an environment where we are afraid to speak up. So I was actually also going to sort of cite an experience from my surgical clerkship, also my first clerkship, this time with one of the attendings. I had sort of had this experience in the OR where I was frankly very scared of being in the OR. I didn't know what to do with my body. I didn't know how to use the instruments. I didn't know what I was supposed to do. And I remember the first time I scrubbed in, I was honestly very scared. Um, but the surgeon came in. I think he was able to immediately pick me out as the medical student because I was standing there not knowing what to do. And he asked me, um, are you the medical student? And then what's your name? And then he used my name throughout the surgery, and he involved me with the surgery, with like stapling and so on. So that was really quite impactful for me. I feel like sometimes as medical students, we can feel like an afterthought almost to some physicians. And I know that we cycle in and out so frequently that sometimes we are an afterthought to attendings. But taking that time to ask me what my name is and then to use my name, I feel is a very simple thing, but it really meant so much to me. So um, that's just my perspective on this question.
Thank you. Those are important perspectives that I think we all can translate into our own education and faculty and administrator duties. And that's why we have you here today, because we really sincerely want to learn. So I think I'm going to close out with our quick fire round, which basically is just asking a question and asking each of you in one sentence to respond. So, in one sentence, in your future as a clinician and a role model, what aspects of professionalism, or what aspect, if you can choose one, do you most hope to foster or create? So in your future as a clinician and role model, what aspect of professionalism do you hope to foster or create? And perhaps I'll just call on each of you. And if you want to pass, just pass. That's fine. Samantha?
Well, in line with kind of what I was saying before, I would love to contribute to a culture where professionalism is defined more by reciprocity, right? And where respect flows in all directions, and that more rigid hierarchy kind of gives way to genuine mentorship. Because when we make space for each other to learn with compassion and understanding and self-awareness, I believe that everyone benefits, including the patients.
Amazing. I believe Hannah is not here, so I'm not going to call on her. If I'm wrong, please just jump in. But next, Anastasia.
Yes. So I hope to foster a kind of professionalism that never loses sight of humanity, where compassion and competence are seen as equally essential, and one where there is safety for honesty, mistakes, and growth.
Thank you. Allison, if you could.
I hope to foster an environment where professionalism reflects open communication with respect and understanding of the environment with set expectations, but openness for questions.
Amanda, if you would.
Yeah, as I was saying before, I hope that in the future I'll be able to like give the kind of attention and notice what all of the other, especially trainees around me, are doing, so that I can kind of help foster them as physicians, and learn from the things that I'm noticing as well.
And Kevin, if you would.
I hope to foster an environment where my future patients feel well cared for, listened to, and confident in my ability to properly care for them. So a patient-centered approach.
Awesome. Andrew?
Yeah, I'd love to foster a culture of taking ownership for our collective experience and recognizing our roles and finding solutions to problems rather than expecting others to find them for us.
And finally, Julius?
To this, I will say I want to create a professional environment where everyone has a name and a voice.
Oh, thank you. So I just want to reiterate the words we just heard as, an expression of gratitude to you students. The words that you echoed for us were respect, compassion, humanity, competence equaling compassion and value, open communication, understanding, notice, attention, well cared for, patients and us, confidence, patient-centered, ownership, solutions, and having a name. So with that, I thank you. And I know that you are so busy, and your time is really something that we value. And so please accept our gratitude for sharing your voices today, the voices of our future. Please help me in thanking our students.
Thank you for having us.
Thank you for having us.